Hey folks, it's noon, so it is time for the weekly COVID brown bag. I apologize for last week. I just needed a break. Picked a hell of a week to do that, given the amount of news and things going on in the COVID world in the last 2 weeks. Um, just an FYI, I probably will take another break in the next few weeks before the semester starts, just because I've not had a vacation. And the vacations I want to take right now probably preclude me from broadcasting because it'll probably be a solo motorcycle trip out into the wilderness somewhere. So I won't be able to do that. So I'll let folks know if I can't do that. So, anyways, lots to cover this week. As usual, this will be on Facebook Live, as well as uploaded onto my YouTube channel, which is called, by the way, if you don't know, No, I won't look at your mole. It's an inside joke, an inside epi joke. So if you're missing this, don't fret. It'll be recorded on Facebook and also on YouTube. So, all right, let's get started. Like I said, there's a lot of stuff going on right now. To summarize, we're not in a great place at all. Numbers are spiking all over the world, driven by the Delta variant, and that includes the US and Utah. So really not great news. There's some good news in some parts of the world, but in most of the world, we're seeing a serious spike driven by this new variant. Numbers are going up, and in areas with very low vaccination rates, we're going to see huge spikes in hospitalizations and deaths, particularly because the regions that are being hit hard just lack the resources that the North America and Europe and a lot of Asia have. So we're talking, of course, about the spike in Africa. So we'll talk a little bit about that. So you can see that we are seeing a sustained increase. We've kind of bottomed out mid-June, and now we're seeing a spike. And it's a little bit worrisome how big this spike is going to be. We are now at, we had a 26% increase in cases in the last 2 weeks. We're averaging about 470,000 new cases a day. Now, I'm warning you that this is probably even worse underestimate than we've seen in the past, mainly because a lot of these numbers are coming out of Africa. They just simply don't have the infrastructure to be able to test and report data like Europe and North America could. So this is probably even worse underestimate than in the past. Something to keep in mind. Deaths are also increasing, although not as quickly. We'll see, again, death is a lagging indicator, so we probably will see an increase. But again, this was probably going to be an underestimate because the countries being hit hard right now, a lot of the countries being hit hard right now lack the infrastructure. We saw what happened in India during their spike and how underestimated the deaths were. So again, from an epi standpoint, these numbers are going to be probably underestimated to a significant degree. If you recall, by some estimates, the deaths in India were underestimated by a factor of 10. So death numbers coming out of Africa are going to be really, really, really tough to get a hold of, to get a good idea of, but they will be underestimated. So keep that in mind as you see these numbers. So this is the New York Times hotspots map, which I really like. And so you can see immediately where the hotspots are. South America, there's some good news coming out of South America, actually, but the levels still remain very, very high, particularly in some countries, Argentina and Colombia in particular. So things are getting better, but things were so bad before, that getting better. We still have a long ways to go in South America, but at least they're trending in a positive direction. I'll show you maps of that. Cuba is having some issues right now. They're seeing a big spike. Parts of Western Europe are starting to see huge spikes. The Low Countries, Belgium and Netherlands, Denmark, the UK, of course, we've been talking about the UK. Their struggles continue. Spain and Portugal are seeing spikes. So Europe is now in the midst of a serious spike. Africa is in the midst of a serious spike. And again, what's worrisome about Africa is just the lack of infrastructure in Africa and lack of resources. These are countries that have been fighting COVID for a long time, and they're about at, they're at the limit of what they can handle. They've done such a great job of really fighting off this pandemic, utilizing good traditional public health, but now they're just facing shortages of hospitals, ICUs, oxygen's becoming a huge issue. And as a result, deaths are starting to spike in some countries, particularly in Namibia, Tunisia, South Africa, Botswana. Just again, keep in mind that the numbers out of Africa are probably even worse underestimates than what we're used to. Okay. So even though things look bad in Africa just from the numbers, it's probably far worse in real life. The Middle East is seeing a spike. Mongolia continues to struggle. And the epicenter of the Asian outbreak is now centered on Indonesia, Malaysia, and not necessarily India, where things have gotten quite a bit better since a few months ago. So that's what's going on in the world today. And of course, the US is seeing a surge as well at the initial stages of a surge, with some states are worse than others, but it's fairly consistent. Most states are starting to see an increase. So these are the daily new confirmed numbers according to our World in Data. So you can see that Russia, Spain, France, even the Belgium and Netherlands, the UK, the US, parts of Southern Africa are all seeing some serious surges right now. Also with Indonesia, excuse me. And there's some real concerns with Indonesia because, again, similar to the conditions in India, they just don't have the infrastructure to handle a surge like this. So here it is by continent. So you can see that South America, some good news. Numbers seem to be going down in South America. Europe has actually exceeded South American numbers. Now, this is just counts. So cases per day, not adjusted for population at all. You can see Asia, after a long, steady decline, has now started to go up again, driven mostly by Indonesia. People don't realize that Indonesia is one of the most populous countries in the world, with a population slightly less than that of the US. So excuse me, my Facebook feed, I just gotta make sure this is working. Yeah, it seems to be okay, good. So anything that happens in Indonesia, again, it's amplified because it is such a populous country. And so that is what's driving the Asia, this turn in Asian numbers. North America, we're starting to see an increase, mostly driven by the US. Canada continues to do well, but US and Cuba, we're seeing some spikes, along with some countries in Central America. Africa, I've mentioned before. Again, these numbers, what's really nerve-wracking about Africa is that the numbers are probably a huge underestimate. It's hard to determine how much of an underestimate it is. And even Australia and New Zealand is seeing a bit of a spike. Again, relatively speaking, not as big of a spike as some of these the more populous areas of the world, but still a concerning spike, particularly in Australia. Okay, in terms of individual countries, again, these are unadjusted by population. These are just raw counts per day, 7-day averages. Brazil still continues to lead way, but Indonesia is quickly catching up. And probably next week, Indonesia will be the #1 country in terms of cases per day. Both are about 42, 43,000 per day. Again, probably underestimates. India numbers continue to decline. They're at about little less than 40,000 a day. The UK has shot up. So UK continues to struggle, even though they're one of the most immunized countries in the world. And this is reflective of how much more infectious Delta is. We'll talk about that. So the UK is now 4th. We are 5th. And we went up slightly because of our recent increase in cases. Russia is 6th. Spain, I mentioned before, is the numbers are increasing. Iran as well. And then what's concerning is a lot of countries that we haven't seen before showing up in the top 25. So you see increases in Portugal, France, Kazakhstan, Philippines, Turkey, Cuba. Cuba is actually on the top 25. So that's really concerning. They're having a serious increase in Cuba. Luckily, Cuba has a really robust healthcare system, but at the same time, they are lacking resources as well. They are starting to feel the overwhelming crush of cases. In terms of cases per million, you can see that the UK, Cuba, southern parts of Africa, Tunisia, and Mongolia are kind of leading the way. But you can see just overall, a lot of countries are starting to turn darker red than in the past. Indonesia, Malaysia, Southeast Asia is really struggling right now. So we are not in a really good place. So in terms of per million, South America, that's some good news. Cases are finally declining in South America, and that's only just happened in the last week or so. We'll see if this is a data artifact or if they can continue declining. So that's good news because South America has been struggling for so long. But you can see European numbers are really, they're going straight up. North American numbers are doing the same. Asian numbers, they're not going up quite as sharply, but they are starting to increase again after a long decline. Africa, and even Australia and New Zealand, from per capita level, you're seeing some spikes there. So we're not in a good place. Seems like it's again, whack-a-mole is another constant theme of this pandemic. Seems like we're doing well in one area and other areas spike up. So for the longest time, Europe and North America are doing well. Asian numbers and South American numbers were going down. South American numbers go down, the rest of the world goes up. This is an incredibly dynamic situation, and this virus it's a tough foe. It really is. And it doesn't help that we just don't have the global coordination that we need to really fight off a pandemic like this. And that's probably going to be the story of this pandemic is where is the global cooperation? We have taken such a fragmented approach to this. And the virus is just going to find those weak spots around the world to thrive. We need a much more global strategy, and we just haven't had it. We'll talk about that a little bit more, especially in terms of vaccination later on. In terms of per million by country, Cyprus and Seychelles. I've started to include some of these smaller countries just because, I don't think it's fair to exclude them based on some arbitrary size issue. Just know that, countries like Cyprus and Seychelles, these are very small countries, so that outbreaks can really amplify very quickly. Especially, they're both islands, and outbreaks can get really out of hand and get really high. So keep that in mind. But Seychelles has been up on this list for a long time. They've had, for probably a month plus, over 1,000 cases per million. So they've really been struggling. Fiji has seen a big spike. Again, small island country in the South Pacific. Of the major countries, Tunisia right now and Mongolia are probably the top two. They're seeing huge spikes. Mongolia has had really high numbers for a long time, mostly due to mismanagement, a lack of clear communications. Even though they have a really high vaccination rate, they're still struggling. Cuba has joined this list. They've had a huge spike. UK, Namibia, Netherlands, Spain. So we're seeing a lot of countries that we haven't seen on this list. And you can see that, South American countries have gone down on this list a bit. Colombia is the first South American country on here, then Argentina. But you also see some really worrying signs out of Africa, Botswana, Namibia. Let's see, South Africa. So we're seeing a lot of countries in Africa that, again, probably much higher because due to data issues. So that's really concerning. As far as changes, you can see that Southeast Asia, all of Southeast Asia, with the exception of Cambodia and the Philippines, are seeing increases. The US, Mexico, Cuba, most of Africa, most of Europe, and Russia, China, Kazakhstan. So we're seeing overall increases in number of cases all over the world. This is mainly driven by the Delta variant, which is far more infectious than either the original strain from or the Alpha variant. The biggest increase is Malta. Again, very small country, island country in the Mediterranean. So outbreaks can they can grow really, really quickly, just given the population and the isolation. Gambia, that's a country, of course, in West Africa. Very small country, and they're seeing a huge increase. Bosnia, so we're seeing signs that Eastern Europe is being affected again. If you recall earlier on the pandemic, Eastern Europe was hit really, really hard, and then things settled down. But it seems like Delta is starting to reestablish itself, and Eastern European countries will probably get hit hard again. So Bosnia is showing up. Netherlands is showing up. Barbados, again, small country. Chad, Libya, Brunei. So a lot of African countries are showing up in this list. Brunei, of course, is a small, very wealthy country bordering on Malaysia and Indonesia. Indonesia, I believe. Or is it Malaysia? Sorry, my geography. Yeah. That makes sense given the spike in Indonesia and Malaysia. So you're seeing Australia is on this list, Vietnam, so Southeast Asian countries, African countries, and a lot of European countries are starting to show up on this list. Now, we haven't seen the Czech Republic on this list in a long time, but we're seeing that now. So Eastern Europe is starting to get affected, not just Western, but Eastern Europe. And this, of course, is coinciding with a lot of countries opening back up. Relaxing restrictions, increasing travel due to summer. And that's a tough situation. A lot of these countries have been devastated economically, especially ones that are relying on tourism. So this is not an easy, again, we in public health cannot expect to continue using our traditional public health tools like travel restrictions, isolations, economic shutdowns. We can't rely on those tools when we're almost 2 years, year and a half to 2 years into this pandemic. Those are tools that are effective early on in the pandemic, but we cannot continue to utilize those tools continuously. The costs of those tools are too great in terms of economic costs, as well as just fatigue from the general population. And unfortunately, a lot of us in public health don't seem to understand that. We just simply say, well, just shut down again. Well, there's a cost to that. Luckily, we do have a tool, but that tool is being used so ineffectively and so inequitably that we've got to rethink this. And the tool I'm talking about, of course, is vaccination, something that we didn't have this time last year. So anyways, we'll talk about that more in a little bit. So broken down by areas a little bit so we can see exactly what's going on in the world. So this is North America. You can see that the US and Cuba are kind of driving the North American surge right now. Cuba, that line looks a lot like the early days of the Indian outbreak. It's just going straight up. And this seems to be very characteristic of Delta, just how, especially in countries with little to no vaccination, just how infectious it is. We'll get to the R naught, but it seems like it's at least 2 times more infectious. So it's being transmitted to 2 times more people than the original strain. And so that's going to, if each generation, instead of infecting 2 to 3 people, it's infecting 4 to 6 people, it's just going to grow a lot quicker. And you're going to see, especially in countries with very low vaccination rates, lines that are going straight up. And that's what we're seeing right now. That's just like the Cuba numbers. I mentioned Barbados, looks like a little surge there. Dominican Republic and Haiti seem to be doing okay. The data out of Haiti is really sketchy right now. And Haiti right now, will we see a surge due to all of this unrest due to the assassination of the president? Possibly. That's the other problem right now, is that you're seeing a lot of, again, that's one of the problems with these traditional tools. They can't last long before, in some cases, you have violence due to all of these restrictions. That's, of course, exacerbated by just government just corruption and just government mismanagement. We'll talk about that a little bit when we talk about the South Africa in particular, which is really having some struggles. Central America, you're seeing Costa Rica numbers are still at a fairly high level. Panama numbers still at a high level. You're seeing a little bit of a surge in Guatemala and Mexico. Mexico numbers, again, I think this is a gross underestimate. I just don't think I don't think they are testing enough. They're not reporting it. I don't know, but it's just I think they're having far more cases than they're reporting. In any case, it is increasing. The good news is out of South America, their levels are getting down to a more manageable level. Uruguay's numbers have gone down quite a bit. Colombia is still struggling a bit. And again, there is a lot of unrest in Colombia because of the demonstrations, the economic impact. Again, that's one of the consequences of utilizing these tools too long. You can't, the economic costs of a shutdown are too great. It's, you just can't do it for years at a time without political consequences, economic and political consequences. So Argentina numbers starting to go down, but they're starting to level off. We'll see. Brazil numbers looks like they're down, but again, still, they're not, they seem to just, I don't know, Brazil's just struggling still. I'd like to see a little bit more data out of Brazil before I'm more comfortable with the decline that they're seeing. Chile's numbers have gone down quite a bit, so that's really good news. Uruguay and Paraguay, which have seen really high numbers, they're going down. So if there is good news out of the world, it's coming out of South America. It seems like they're coming down from their highs. We'll see if that continues. I don't know, will Delta reestablish itself? Is Delta really taken over in South America? Given the lack of genotyping down there, we're not sure. So Africa is a concern. You look at Libya numbers, look at Zimbabwe, Eswatini, Zambia. Zambia is actually doing okay. Rwanda numbers are going up. Namibia, South Africa. This is the big concern right now. Given the lack of resources in Africa, this has the potential to really impact the continent hard. They've done, like I mentioned before, and I will keep mentioning this, they've done such an amazing job utilizing good public health to really keep the pandemic at bay. But that'll only last so long. Meantime, in the rest of the world, we had variants and Delta. And so we have these huge spikes right now. But you can only utilize those tools for so long. You can't expect countries to have economic shutdowns for a year plus. So, and these countries, unfortunately, are the ones that can least handle the impact of a COVID outbreak. I mean, they're already running out of medical oxygen. ICUs are getting, and hospitals are getting hammered, and yet they still just don't have the vaccines. We'll talk about that in a second, because the New York Times came out with a really great article on how much Africa's just struggling to just get any vaccines. Middle East, Bahrain's numbers are down, but Kuwait, 400 per a million, that's quite a bit. Iran, Oman, Iraq, UAE. So you're seeing increases in Iraq and Iran, which is concerning. Those are two very populous countries. So we're seeing Kuwait's interesting because a big part of the Kuwaiti population is immunized, and I can't find too much news out of Kuwait to kind of, or any of the Gulf states to kind of determine who's being impacted. My guess is that this is driven by a lot by the guest worker population, many of whom are undocumented or ineligible for vaccines. And in those countries, I mean, a lot of the workforce are undocumented guest workers. And again, the conditions tend not to be great for these folks. So that may be what's driving these outbreaks, these continuous outbreaks in those countries. Okay. Central Asia. We're seeing a couple countries. Georgia numbers are starting to go up again. Georgia has struggled. They've gone down quite a bit since last year, but now they're starting to see an increase. Kazakhstan seeing an increase. Kyrgyzstan is having a high level. Mongolia continues to struggle. Again, Mongolia is also one of the most immunized countries in the world, yet they're still struggling right now. And probably because the immunization campaign started late. So again, I mentioned before, you're not going to see immediate effects of vaccination campaigns. It's probably going to take several months to see the effects of a vaccination campaign. Chile, we saw how they were a model for vaccination, yet they saw a huge spike. Especially with the variants, you're going to see spikes, even in countries with high levels of vaccinations, especially with vaccines that are less effective. So that's what's going on in Mongolia. Mix that in with there's been a lot of miscommunication, a lot of government missteps, distrust of public institution. That's what's going on in Mongolia. Georgia, I'm not certain, but probably, again, what we're seeing all over the world. Delta variant, more transmissible, driving the infections. South Asia is doing okay. India numbers have now stabilized at a higher level than you like. Pakistan numbers are slightly going up. Nepal's numbers they've gone down from their highs, but again, stabilized at a relatively high level. Bangladesh is seeing a little bit of a spike right now, which is concerning. Again, very populous country, very crowded, limited resources, so that's a real concern. Southeast Asia. Boy, Malaysia numbers, they were going down, they're going back up. Indonesia numbers are really, really spiking hard. And there's a lot of concern within the global health community, how bad this is going to get in Indonesia. Again, huge population, a lot of isolated little islands, very crowded. And there's a lot of Muslim holidays coming up, and there's a huge concern that these get-togethers and the travel is just going to exacerbate this pandemic, their outbreak. So that's a huge concern right now. Thailand's numbers are going up. Myanmar's numbers are going up. Cambodia is about the only, and the Philippines are the only countries that seem to be doing okay. At least they're not spiking. They're just kind of plateaued. Even Vietnam is starting to go up. And Vietnam has done such a great job for the longest time. Again, utilizing just good public health, contact tracing and social distancing and mask wearing, but they're seeing a spike. So this is a concern. This is a huge part of the world, hugely populous part of the world, and we're seeing strikes. This is mostly what's driving the Asian surges right now, is this region. And even East Asia, Far East Asia, China numbers, we don't know. So far, it seems like they're controlling their outbreak. There doesn't seem to be huge surges in China, as far as I can tell. But again, I don't know. Taiwan's numbers have gone back down. They've done a good job of dealing with this recent small surge. South Korea's numbers are starting to go up, which is a concern. In Japan, and that's a huge concern, given that, what, next week we got the Olympics there. In fact, the hotel where a lot of the athletes are going to be staying, there was an outbreak there. It's not a good idea. Okay. And then finally, not finally, excuse me, even Australia and New Zealand for doing so well. New Zealand continues to do well. And let's, we need to keep this in perspective. This is 3 per million, whereas, in some areas we're talking about 300 per million. So let's keep this in perspective. We are seeing a surge in Australia, and it is concerning that it's going straight up, but it's still fairly low numbers. This is a localized outbreak they're having in Sydney. This is my point again, drives my point that you cannot rely on these traditional methods, isolation, travel restrictions. At some point, that's going to break down. You have to start immunizing. You have to start vaccination campaigns to really deal with this. Taiwan as well. Eventually, that will break down. You're going to get outbreaks in a largely unvaccinated population, and it's going to hit hard, especially with variants. And that's what's happening in Australia too. So worth keeping an eye on. So far, it's very small, and the Australian authorities are doing a good job of contact tracing. They have a really robust public health system. We'll see where this goes, if they can get this under wraps. But really, these countries, even though they've done such a good job in the past, they need to vaccinate. And then finally, Europe. And you can see Europe is getting hit hard with Delta. UK, but the Netherlands, look at the Netherlands numbers. It's going straight up. Same with Spain, Greece, Portugal, Ireland, Denmark, Belgium. You're all seeing surges there. These are not insignificant surges. These are fairly significant surges. Netherlands in particular, it's just going straight up, and they're probably going to exceed the UK in a little bit. The UK numbers are still, maybe they've lightened off a little bit, but they're still going up. And again, this is one of the most vaccinated countries in the world. So that is what Delta has done. It's changed the dynamics of this pandemic. As far as deaths concerned, we are now over 4 million. Again, probably a gross underestimate. We'll see. But yeah, probably a gross underestimate. But we have exceeded 4 million deaths. You can see that per deaths per day, we've kind of started to turn, and they're starting to increase again, driven largely by unvaccinated countries. Yeah, so we're now at about 8,000 deaths per day globally, and it's starting to go up again. The hotspots in terms of death, Brazil remains a hotspot, but you can see India still has a lot of deaths. Indonesia, these are of course counts. Now, you can see that Asia right now is #1 in deaths. Again, this is counts, not overpopulation. Then South America. So South America's dipped a little bit, again, because their numbers are going down. Europe's numbers and North American numbers, even though they're seeing a surge, again, death is a lagging indicator. So if we're going to see increases in deaths, we're not going to see increases in those areas probably for another few weeks at least, maybe another month. However, with Europe and North America, I doubt we're going to see a huge surge in deaths because of the level of vaccination in those areas. Africa remains a concern. And what's concerning is lack of data coming out of Africa. Cases are underreported, but deaths will be even more underreported because it is so difficult to classify deaths and to record deaths. We saw this in India. India's, has a fairly, for a upper middle income country, they have a decent public health system. But even they were not, prior to COVID, they 1 to 5 to 1. I mean, they were only reporting cause of death in 1 to 5 to 1 to 7 deaths. With COVID, by some estimates, it was 10 to 15. It was COVID deaths were underreported 10 to 15 fold. What will be interesting to see is excess deaths later on to determine what the true impact of deaths were. So again, my point here is African deaths, yes, it's going up. I'm afraid that these are going to be really, really, really underestimated, even more so than the Indian numbers. In terms of counts, Brazil is number one, about 1,200 deaths per day. India has gone down to less than 1,000 deaths per day. Indonesia is increasing, though. My guess is Indonesia will probably exceed India in the next week or so. Then Russia, Colombia, Argentina. So they continue to struggle with deaths. Even with this recent decline, you're going to probably see deaths still at a fairly high level for the next few weeks. South Africa, and then the US. So South Africa has now exceeded the US. Bangladesh is starting to catch up. Again, what you're going to see, especially with deaths, is two very different scenarios, two very different situations between the vaccinated countries and the unvaccinated countries. In the vaccinated countries, even if you do see surges, you're not going to see huge surges in deaths. We'll probably see an increase in deaths, yes. However, we're not going to see the levels that we saw prior to vaccine campaigns. However, in those countries with low levels of vaccine, we may see huge spikes in deaths. In terms of per capita deaths, you can see that South America continues to dominate along with the southern part of Africa right now. Even with the spikes in the UK, you're not seeing huge spikes in deaths. And this is what we're going to see. In Africa, where there's very little vaccination, huge spikes in deaths are going to follow spikes in cases. In European countries or any countries that have high degrees of vaccination, especially among older populations, you're not going to see a huge spike in deaths, even if you see spikes in cases. The deaths per million, South America still continues to lead the way, even with their recent decline. And then Europe, North America, Asia, Africa, and Oceania. This is also affected, by the way, by the fact that Asia and Africa tend to be much younger than Europe, North America, or South America. And so you're going to see, if you corrected this by age, if you age adjusted this, it might be a very different picture. But these are crude numbers. And so that's one thing, that's part of what explains Asia and Africa, the low numbers. The other part, of course, is the underreporting. Europe, North America, and to a lesser extent, South America are going to be better at reporting deaths by COVID, whereas Asia and Africa are going to struggle with that a little bit. See, Namibia now is number one in deaths per million. And this is what's happening in Africa right now. They just can't handle. I mean, they've done such a good job preventing it, but once you have an outbreak in those countries, they just aren't going to have, they're just not going to have the medical resources to really fight an outbreak in those countries. In Namibia, Tunisia, so you can see that two African countries are now 1 and 2 in terms of deaths per million. Then Colombia, Suriname, Argentina, Seychelles, Paraguay. So you still have South American countries up there because, again, that's our lagging indicator. Then you got South Africa. You got Botswana on that list, Zimbabwe. So you're having a lot of African countries showing up on this list, and that is really super concerning. I mean, look, surges are concerning anywhere, but they're particularly concerning in countries with very few clinical resources and with low levels of vaccinations. And as you can see, the surge in death in Southeast Asia, parts of Africa, North America, and even in Europe. I mean, smaller increases, but you're still seeing those increases. These are the countries with the biggest increases in deaths. Mauritania, that's of course a very poor country in West Africa. Gambia, Ghana, Guinea, Malawi, Sudan, Namibia. So, you look at that up and down this list: Eswatini, Benin, Zimbabwe, Mozambique, Nigeria. So you're seeing a lot of African countries showing up here, along with some other countries that we haven't seen before: the Czech Republic, Cuba, Hungary. So Eastern Europe is starting to see that rise again, and a lot of Southeast Asian countries, Thailand, let's see, Myanmar. So in terms of numbers, we're not in a good place. Overall, we're seeing surges in most parts of the world, with the exception of South America, where numbers are down. But in most of the rest of the world, we're seeing huge increases in numbers, again, driven mostly by Delta, lack of vaccination, and just breakdown in. It's just we're opening back up. Travel's increasing. People are getting back together again, and I'm not blaming folks for wanting to do that. Again, those are tools that are effective initially, but you can't expect people to continue doing that for years and years and years. Okay, so let's talk about vaccinations. 3.5 billion. That seems like it's good news, and it is. That's 3.5 billion more doses than we had just little more than 7 months ago. So that's good news. Number of people release one dose is about 2 billion people. Sounds great until you realize we still have about 6 or 7 billion people in the world. By the way, China, this big jump, China decided to share data. That's why data from China was added on June 10th, and that's why you see this big spike. China has been really vaccinating their population, which is good because they have a huge domestic vaccination capacity. So they have been vaccinated. They finally shared that data. That's why you see this big spike. Okay. So that's about roughly 25%, a little bit more than 25% of the world with at least one dose of the vaccine. That sounds good, but then you realize how inequitable that is. In some countries, 70% plus have at least one dose. Other countries, no one's been vaccinated. In terms of countries, you can see I did add some smaller countries like Malta. I mean, vaccination campaigns in smaller countries is a lot easier. That's why Malta has, over 80%. Even then, they're still having a bit of a spike because, again, they just recently really ramped up their vaccination campaign. And, we've seen how Delta, how much less Delta is effective with one dose. So, again, you're going to see more breakthrough infections there because most of those folks probably haven't been vaccinated soon enough. Iceland, UAE, Seychelles, Uruguay, Canada, Chile. So, these are all countries. You notice also how far down the US is now. We are at the very bottom of this list as far as percentage of the population with at least one dose. We're at a little over 55%. Whereas countries like, yeah, I agree. You can't compare Malta and Iceland to the US. Let's say the UK or Canada. Canada is a better comparison. Canada is up to 65% with at least one dose. So, so we have lagged quite a bit behind. But again, it is concerning that you have countries that are seeing spikes that have high levels of vaccination. The UK, the Netherlands. Now, notice that the UK, Netherlands, again, only about 40% or 40 to 50% of their population has one dose. So we'll get to that in a second. Remember, with Delta, one dose is not very effective at all. 2 doses, very effective. 1 dose is not very effective. That second prime dose is really, really critical. Right. So in terms of vaccines administered per 100 people, we are now pretty far down the list. Europe is number one. They're vaccinating more than about 0.5% of their population per day, which is decent. South America too, they have really increased their vaccination rates, so they're vaccinated quite quickly. Asia's numbers have dipped a little bit. That one's hard to kind of see because China has not been sharing their vaccination data as much. So that could be much higher. It's hard to tell. New Zealand and Australia finally started to vaccinate. I think they had a little less urgency to vaccinate because they've done such a good job controlling it. And we've seen the limits of that. Taiwan, Japan, even now Vietnam, Australia have seen the limits of that. That one person can spark a huge outbreak. So those tools are limited. You can't continue with just travel restrictions and isolations and economic shutdowns for a long period of time. It will eventually catch up to you. You've got to vaccinate. And then North America, we've really declined. And it's not Canada, it's the US that's driving this. But really the story here is Africa. And this is going to spark a lot for a lot of us in public health. It's going to really spark a lot of discussion and soul searching, how we failed in our vaccination campaign. And we have, because Africa, almost no one's vaccinated. They had a very modest goal. COVAX had a modest goal of 20% of Africa vaccinated by the end of this year. We probably won't reach that. Meanwhile, we have excess vaccines. We've ordered far more vaccines than we need. Most of European countries, most of the wealthy countries have. And we can't even literally can't even give our vaccines away in the US. Yet Africa still struggles. There are countries where there's no one vaccinated. And yeah, so this just shows Africa, no one's getting vaccinated in Africa. Meanwhile, Asian vaccination rates are increasing. North Americans is decreasing, which is really concerning. And then, by income, the upper middle income, that's again driven largely by India and China. But you can see the low income countries, very little. This is a huge problem. This is something that we're going to have to address in the future, well, in the near future, because we need to figure out how to vaccinate Africa. Again, I sound like a broken record. No one is safe until we're all safe. Okay. What happens locally is going to be affected by what happens in Africa. The more this virus circulates, the more likely we're going to get breakthrough infections and more likely we're going to get variants. So this is Africa, the vaccination in Africa. As you can see, there's a huge variation in Africa. So this is daily doses per 100,000 people. And you can see some country, Cape Verde is a very small island country off the coast of West Africa. Morocco is a little bit wealthier, North African country. They've done a good job of vaccinating. Sao Tome and Principe is, again, a small little country. You can see the major countries. South Africa is recently just began to ramp up their vaccination, but again, that's the wealthiest country in Sub-Saharan Africa. And if you look at this, you see some of these bigger countries like Nigeria or Ghana or Democratic Republic of Congo. There's very little vaccination happening. And as far as doses being administered, most of it is Oxford AstraZeneca. Okay, so the viral vector vaccine out of the UK. Most of it is that. And that makes sense given how it's cheaper and also a lot easier to distribute because they don't have the infrastructure requirement that the mRNA vaccines have. And then Sinopharm, which is an inactivated vaccine. So again, easy to distribute. And the Chinese have been really, really, kudos to the Chinese for sharing their vaccine, to getting it out there. Do they have ulterior motives? Yeah, it's vaccine diplomacy. But still, they're doing a phenomenal job. And without the Chinese vaccines, there'd be almost nothing it would be a lot fewer people vaccinated in Africa. Pfizer, the problem with Pfizer and Moderna, and I will admit that, is lack of infrastructure in most of Africa. So there are some countries that can handle it. Rwanda, South Africa, Tunisia. Those are the countries that have some infrastructure to handle that vaccine. For a vast majority of Africa, it is going to be difficult to administer the mRNA vaccines. We've discovered this even in the US, in rural parts of the US. It's just difficult to get those vaccines out there. Johnson & Johnson, mostly South Africa, and then the rest of them, Covaxin. This is the big one. COVAX was supposed to get Covaxin from India. However, because of the huge Indian surge, they rediverted all of their vaccine to domestic use. So that was a big part of COVAX's plan to vaccinate Africa, and the Indians, for rational reasons, diverted to take care of their own population. So again, this is something that we're going to have to address. We're going to have to address wealthy countries hoarding vaccines more than they need, and basically having the rest of the world have nothing. And that's going to hurt everybody in the long run. And this is their vaccine target. So again, by 2022, right now, 6% of Africa will be vaccinated. Again, the goal was 20%. So even if they increase vaccination rates fivefold, we still wouldn't reach that level in Africa. Right now, it's only less than 3% are partially or fully vaccinated in Africa. So there's an excellent article on New York Times today on this issue. I encourage you all to read it. I can share it, I guess, with you. See if I can get it real quick. Let's see. Yep, there it is. So I will put it on the chat here if you're interested. Like I said, I think it's really, really excellent. I'm glad they wrote it. So it's on the chat here, and I will put it on Facebook as a comment. All right. So let's talk about the US. By the way, right now, vaccination is the primary tool. I mean, it is the tool. Like I said, when we're fighting a pandemic, if a vaccine is available, that is ultimately what's going to get us out of the pandemic. We cannot rely on shutdowns, isolation. We can't rely on those for a long term. Those are at best short-term tools. They're very effective short-term. Long-term, they start to break down. In fact, I would argue they actually erode trust in public institutions and public health. We can't utilize those. Those are very, very powerful tools that only have a very short half-life. We need to incorporate vaccines as soon as possible. And we haven't done a good job of that. Okay, let's talk about the US numbers. US, like the rest of the world, is seeing a surge. You can see this surge right here. Cases have gone up, have doubled actually in recent weeks. So cases per day have doubled in recent weeks. So we are now seeing a rise in cases. And we are seeing a rise in hospitalizations and deaths. So again, this idea that COVID is not harmful, is harmless is bunk. And by the way, most of those hospitalizations or deaths are now in younger people. So look at the hotspots here, and you can see, boy, Missouri and Arkansas, Louisiana, the Deep South is seeing surges. Texas is starting to see increasing numbers. The Intermountain West, including Utah, Nevada. Actually, it's the whole country, but you're seeing bigger increases in certain areas of the countries than others. Take a look. These are counts. Florida is now number one, almost twice as many as California. It's seen a huge increase. Florida's seen a huge increase, a 230% increase in the last 2 weeks. California has even seen an increase, less of an increase. Texas has seen an increase. So you can see just about every state has seen an increase in the last 2 weeks. In terms of per capita, Arkansas and Missouri lead the way. You saw how bright that were. It seems like Branson was a bit of a super spreader event. Those of you who don't know Branson, Missouri, it is a very popular tourist destination, kind of I like to call it a countrified Las Vegas. I don't know if that's accurate or not. But it's a lot where a lot of people like to vacation, a lot of nightlife. It seems like it's also a Delta super spreader. Folks who like to go to Branson are also, not to generalize, but less likely to be vaccinated. So nice combination there. Florida's third now. Louisiana, Nevada, Utah. We're not, U.S. Virgin Islands is there, but I'm just looking at U.S. states. Utah, Wyoming, Alabama, Oklahoma, Mississippi. So you're seeing, with a few exceptions, these are states with fairly low vaccination rates, which is what we're going to see. I mean, this is what we're going to see in the future. We're going to see, again, a tale of two pandemics. A pandemic for those who are vaccinated and a pandemic for those who are unvaccinated. For those who are vaccinated, yes, our danger has increased a bit. Those who are unvaccinated, it's really bad out there right now. It's really bad. This is the other end. So you're seeing a few, these are but look at just about every state has seen increases. Again, the degree of increases is different, but you're seeing increases in just about every state. But you can see that the states with the lowest per capita, South Dakota is a bit of an anomaly because they have extremely low vaccination rates, but they have very low rates right now. Pennsylvania, Vermont, Maine, Maryland, New Hampshire, Michigan, Massachusetts, all have relatively high levels of vaccination. Wisconsin, North Dakota, again, a little bit of an anomaly, North Dakota, Minnesota. So there's a general trend. Those states that are not seeing huge increases and still have low per capita rates tend to be the ones that have higher vaccination rates. But as the UK and Israel has shown, even those states with, Israel has close to 70% of their population vaccinated, they're still seeing a surge. That's what Delta has really changed that equation. The level of vaccination that we have to really control this is much higher, given the increased transmissibility of Delta. So I'm afraid even in states with high levels of vaccination, say Vermont or New Hampshire or Massachusetts or New Hampshire, are probably going to see small surges.
No, que se me había salido de todo.
Deja, did you have a question or? Okay. All right. As far as states that saw the biggest increases, Tennessee, which has one of the lowest vaccination rates in the country at 38%, seeing almost a 400% increase in the last 2 weeks. Florida, Vermont has actually seen it. Vermont, Massachusetts, you can see it again. Just because you have high levels of vaccination does not make you immune to surges, increases. But you look at Vermont and Massachusetts, they're at 2 and 3 per 100,000, whereas Florida is 26 per 100,000. So Alabama's 14, Louisiana 24. So even though they're seeing a huge increase from an absolute standpoint, it's not huge. So that's a good question, Kristen. With U.S. numbers, I have a fairly high level of confidence. I think South Dakota, a lot of that is, of course, based on testing, right? So the less you test, and we know that in all states, testing has declined dramatically. And South Dakota's never had a very robust testing program. They just, some state governments have embraced this idea that the more testing you do, the more cases you discover. It makes you look bad. And so a lot of governments have taken that to heart and not really invested a lot into testing. Idaho is another example. They've had a horrible testing regimen, quite honestly. And I think that's not due to my colleagues in public health, but usually pressure from state governments. So, the confidence, here's the thing though, right now, given the high levels of vaccination, we're probably getting a lot of asymptomatic cases. People probably have COVID and they're not reporting it because it's very mild. So without that testing, we're never going to be able to spot that. So I think all these numbers are underestimated because of lack of testing. And because most of us are vaccinated, even if we do get it, it's extremely mild. It's hard to say. But I think the degree of underestimation is probably consistent throughout the country. I don't see South Dakota. I mean, as you probably all know, I'm not the biggest fan of the South Dakota governor, but I don't think it's underestimated to a significant degree. In South Dakota, I mean, as a state, it's such a sparsely populated state. It's not necessarily. I mean, if you have an outbreak, it can get bad, but I don't know. I don't think it's a significant hotspot right now. All right. Anyways, well, so back to this. I mean, again, you can see. Oh, hold on a sec. Excuse me. So biggest increases. Again, you can see that just about every state has seen an increase, even states with high levels of vaccination. That's a challenge of Delta. Okay, we have to reach an even higher level of vaccination to be able to control a highly transmissible variant. Okay, so if we thought 70% could control things, well, we're going to have to up it to 80 to 90% because, again, Delta is 2 times more transmissible than the original strain. All right, as far as deaths are concerned, California leads the way, and as far as counts daily per day, that makes sense given California is such a populous state. Then Florida, Texas, Missouri. What's more interesting is the per capita, and Wyoming leads the way in per capita deaths right now. And then Missouri, Nevada, Montana, Arkansas, Maine, Arizona, Louisiana, Florida. So again, a lot of states that have relatively low levels of vaccination. Maine, by the way, is a little bit high because Maine's also one of the oldest states in the country, believe it or not. Most New England states are extremely old. The population is skewed old, I should say. What's concerning though is Utah showing up in this list. Utah has the youngest population, but yet our per capita death rate is kind of creeping up, and that's a bit of a concern. So U.S. numbers, we're starting to go up. Some states more than others, particularly the Southeast, Missouri, Arkansas, some in the Intermountain West, but overall, just about every state has seen increases. Almost all of it is driven by the more transmissible Delta. In terms of vaccinations, not great news in the US. We've pretty much stagnated. We've about 185 million doses of people have received at least one dose, but that is only less than 56% of the total population of the US. And we've kind of stagnated. Less than 50% are fully vaccinated. And remember, that's the number that we want to key on because Delta is not very effective in people with one dose. So breakdown by age, you got, if you look at 12 and up, it's about 56, 57%, and 18 and up, it's almost 60%. But again, given the highly transmissible nature of Delta, I'm afraid we're going to see some huge, probably some significant surges in cases. I don't think we're going to see the number of hospitalizations and deaths that we saw, especially over winter, because of vaccination and because we vaccinated most of the at-risk folks. But we're going to see surges, and we're going to see hospitalizations skew younger and deaths skew younger, because those are the groups that are least likely to be vaccinated. So you can see that we are now averaging about 500,000 doses a day. And it's just frustrating because half the population is still not vaccinated. So that's really frustrating. I mean, at one point we were vaccinating close to 4 million people a day. We're now at about 500,000. So that's why I say we're stagnating hard right now. And it's frustrating because this is what, I mean, we have an effective tool. If we could just get folks vaccinated, yeah, and it would take care of a lot of problems. But yeah, we just can't get a few folks vaccinated. And it's highly variable, right? I mean, these are at least one dose. West Coast and the Northeast, not a problem. Some parts of the Midwest as well. Southeast, boy, Idaho, Wyoming, this is fully vaccinated. Yeah, this. And it's going to be, we're going to see surges, and it's going to be very regional. We're already seeing that. We have this huge surge in Missouri and Arkansas. And this is by county. So yeah. Is it any wonder that we're seeing surges right here? No, not really. Nevada, Wyoming, parts of Texas, Louisiana, parts of Florida. No, it's not surprising at all. And that's the pattern that we're going to continue to see. Will we see increases in New England states or California? Yes, because again, the UK has shown high levels of, even having 70% of your population with one dose is not enough to really blunt Delta. But the increases aren't going to be nearly as high in the highly vaccinated states as they are going to be in states like Missouri, Arkansas, Mississippi, and Alabama. And here is the vaccination levels by state. I sorted this by at least one shot, and you can see Vermont, boy, and this is the population of the entire state, not just over 18. Now, granted, Vermont and Massachusetts are relatively older states, but still, that's phenomenal. 75% with one dose, 71% in Massachusetts, Hawaii, close to 70% in Connecticut, Maine, and Rhode Island. And you can see the fully vaccinated, 67% of Vermont is fully vaccinated. So it's good news. Meanwhile, down at the lower end, boy, Mississippi, 38% with at least one dose, 34% fully vaccinated. What that also tells me is that there's only 4% difference there. They've pretty much stagnated. They're not going to be able to vaccinate too many more people there. Same with Idaho, Wyoming, Alabama, Tennessee, and you can see the doses used. They're not using all their doses. Idaho is they're only using 79% of their doses right now. Mississippi, 76%. So they've pretty much vaccinated just about everybody that's willing to get vaccinated, and that's really concerning. So this vast, this difference is just killing me. 75% versus 38%, more than twofold difference, or about twofold difference. Excuse me. Utah does not look like it's doing great here, but again, Utah is skewed young. So actually, if you break it down by percentage here, if you break it down by, this is sorted by 18 to 64, Utah doesn't do quite as badly. I mean, we could do a lot better, of course. But boy, you look at, Utah, 62%, 18 to 64 is vaccinated. Mississippi, 40%. Louisiana, 42%. I mean, that's just incredibly low. Then you look at the 12 to 17. Utah has about 35% of 12 to 17, which is decent. Not as good as Vermont, which has 67% of their 12 to 17-year-olds vaccinated. But then you look at Mississippi, 12%. Idaho's not even reporting this, and I'm not sure why. I think it's because they just haven't. Ugh. School's gonna be very interesting in Idaho this fall. Deja.
Juan, I had a question.
Yeah.
What possibility the University of Utah students are going to be pushed to get the vaccine? My question is if there is a rule for them because they follow the state. Yeah, we don't have this problem at Westminster, but the University of Utah student.
Yeah. Well, yeah, I'm gonna have to check with that. I know that the legislature has been talking about banning vaccine and masking mandates for public institutions. I'll have to check on that, how the EU is going to navigate that. We, of course, as a private institution, can do whatever we want. Right now, the plan is that if one of the vaccines has full FDA approval, we're going to require a mandate. And but that's reliant on getting the full FDA approval, which some folks are expecting in September, October. So a lot of states, as you probably know, Arizona, Texas, have flat out banned any sort of vaccine mandate or even a mask mandate by the state legislature. So, if you're at University of Arizona or Arizona State or University of Texas, you can't even do a mask mandate. So it's one of the nice things about being a private institution. Yeah, that's what I thought. Yeah, we can't. Yeah. This is science by legislatures. Yeah. Thank you, Joanne, for that. Yeah, I thought so. I thought the state institutions cannot they can't put any sort of vaccine mandate or mask mandate or even social distancing. That's crazy. So, okay. This is an interesting graph. So this is when states will vaccinate 70% of adults. So we've already passed the July 4 deadline, obviously. In a lot of states, we as a country did not meet that. However, several states have. And these are the states in the corner that have reached 70%. Utah's actually really close. Yes, we had some screw ups and Governor Cost came in and said, hey, we made a mistake. I'm not too worried about it because honestly, 70% is a totally arbitrary number anyways. And quite honestly, given Delta, I don't know what 70% is really going to do. Because look what's happening in the UK. They have far greater vaccination rates than us, and we're still seeing huge surges. So, but it's a good goal. It's a nice even number. It's achievable. We didn't achieve it, but no. And Utah's really close. But these states, these are the dates that they are projected to reach that level given their rate of vaccination right now. You can see some of these states, boy, they are not going to reach it until next summer. West Virginia, they're predicting they're going to reach it, given this rate, 2025. So that's where we're at. We're quickly splitting up into two different countries where we're going to see relatively COVID-free areas and then areas where you're going to see huge surges in COVID. But of course, that's going to still, if folks in Vermont and Massachusetts are sitting, thinking that hey, we're safe, we got vaccinated. These are also going to be variant factories. The more COVID circulates among susceptible hosts, more likely variants are going to occur. So. All right, so let's talk a little bit about the vaccines and breakthrough infections because that seems to be dominating news. A little bit more about Delta. There's right now no solid evidence that Delta is more deadly or causes greater symptoms than any of the other variants. I just want to clarify that. I know there's some data coming out of Scotland saying that those with Delta are 2 times more likely to be hospitalized. That is not really confirmed yet with good data, in my opinion. There's also some more anecdotal clinical evidence that there's slightly different symptoms. They call it Delta symptoms. I haven't seen solid evidence that that's true. So I want to get out there. I'm not saying that it's not more severe, but I'm just saying that we don't have the data right now to confirm it. The UK public health folks have said that they haven't found evidence of that either. But we do know one thing that we do know, and that is fairly certain, and is good evidence, is that it is much more transmissible. So here are the R naughts. So R naught, for those of you who don't know, is a simple number to determine how transmissible a disease is. So an R naught is basically R naught represents a number of people that one infected host will infect before they become non-transmissible. So through either they recover or they die from the disease. So R naught of 2 would basically say that one person would infect 2 people before they recover or die. And then those 2 people will infect 2 more. And you can see, I mean, it's a very easy calculation. You can do it like they say in Contagion, you can do it on a cocktail. You can do it on a napkin. You can do the math. It's really easy. 1 to 2 to 4 to 8 to 16, 32 to 64. Yeah. So that's an R naught. So the original strain was estimated to have an R naught of 2.4 to 2.6. So about 2 to 3 people. Each person is going to affect 2 to 3 people. Okay. It's a rough number. We do know that a lot of super spreaders will spread to a lot more people. Other people won't spread to anybody because they isolate, or for whatever reason, they don't spread it. But on average, that's what happens. Alpha is estimated that's about 4 to 5, so roughly double. Slightly less than double. Delta, we are estimating 5 to 8. So double the original strain. So that changes the dynamics quite a bit. Right? So again, even if you have 50% of your population vaccinated, that means 50% of the susceptible hosts are no longer susceptible. Half the hosts are now unavailable to the virus to replicate. So if you have a less transmissible virus, it can be controlled. But you have a much more transmissible virus. So therefore, even if you have 50% of the population vaccinated, you still have a lot of susceptible folks out there, and you can still spread. So that's what Delta has done. It's completely changed the dynamics of this pandemic because it's that much more transmissible. Just as a reference, the most transmissible disease that we know of is measles. It's about estimates of an R naught of about 12 to 18. One person spreads it to about, on average, 12 to 18 people before they recover. That's why measles is, that's why the herd immunity level for measles, probably talking about 90% vaccination rates to be able to control measles. So we're getting a lot of news about breakthrough infections. COVID outbreak among vaccinated Vegas hospital workers. They were all vaccinated, they still got COVID. And then you hear about these, this wedding, outdoor wedding, 6 vaccinated guests get it. And this one, I think there were several workers were infected. Well, there were like 10 people who were infected at these, and only one of them was uninfected. 9 of them, one of them was unvaccinated, 9 of them were vaccinated. And a lot of people they're thinking, oh my gosh, out of 10 people got infected, 9 actually had the vaccine, 1 didn't. The vaccine's not effective. That's really bad logic and bad math. Okay. In fact, it's called base rate bias in epidemiology. Oh my gosh, we had 10 cases, 9 of them were vaccinated, only 1 was unvaccinated. The vaccine is not effective at all. That is incorrect. Remember, efficacy of a vaccine is efficacy of a vaccine is based on everybody in the population, vaccinated and unvaccinated, not just one outbreak. Okay, so we've got to be careful with this, but there's a lot of headlines like this that are really, really impacting folks. And in fact, Pew Research survey has shown that because of Delta, there's less confidence with the vaccines, and they're less likely to get vaccinated because of all this news. They're hearing, oh my gosh, these people got vaccinated, and they're still getting COVID. Now, we need to stop thinking of vaccine efficacy as this kind of black and white. You're either protected or you're not. It's like everything else, it's a gray area. It's a continuum, okay? And there's a lot of variables that go into it. For example, 6 vaccinated guests at outdoor wedding. The person that, the index case in this case was someone from India. Now, I guess I don't know how they did it, but the couple basically made sure everyone was vaccinated at this outdoor wedding. But one couple from India had I think Covaxin, which is not as effective. They brought Delta over, and yes, so it was outdoors, but just because it's outdoors does not mean you're going to be completely prevented from getting it. They probably had an extremely high viral load. They're probably dancing with people. They were probably kissing, hugging. Boom, super spreader event. It doesn't matter if you're kissing and hugging indoors or outdoors. It's still going to spread the disease. Okay, so you probably had a really high probability of transmission anyways. The better question is, what if no one was vaccinated in this situation? My guess is if no one was vaccinated, you'd probably have, out of 100 people, you might have had 50, 60 people infected during a super spreader event like that. That's not unheard of. So that's the better question to ask when you hear this. What would have happened if no one was vaccinated in this wedding party? Okay, rather than say, oh my gosh, 100 people were vaccinated, 6 people still got the disease. Okay, so vaccination reduces the risk of transmission or symptomatic disease significantly, but does not reduce it to 0. You might have great immune response, but if you are bombarded by virus and you get a huge viral load, your immune system is just a race at that point. The virus is racing to replicate as fast as possible. Your immune system is racing to mobilize as fast as possible. So yeah, even if you're fully vaccinated, you had a good immune response, if you are just completely overwhelmed with virus, you could get the infection. Luckily, chances of it being symptomatic are really, really low. So even someone with a really robust immune system can still get exposed if you get high enough viral load. But you gotta have an overwhelming amount of viral load to bypass your immune system at that point. Okay, so all the data. So this Israeli study has really kind of freaked a lot of people out. And it's not even a study, because I can't find the study. I can't find raw numbers. No one can find it. It says the Ministry of Health that since June 6th, there was a marked decline in the effectiveness of the vaccine in preventing infection and symptomatic illness. Decline is observed simultaneously with the spread of Delta variant in Israel. Nevertheless, vaccine maintains efficacy about 93% preventing serious illness and hospitalization rates. That 64% really freaked people out, because we're talking about Pfizer. Most of Israel was vaccinated with Pfizer. That freaked people out. I thought it was 95%. 64%. What's going on? Well, we don't know, because I can't get the numbers. No one has the numbers. This isn't based on any sort of peer-reviewed study. It's just a Ministry of Health report. One of the things that could be happening is that people who are vaccinated and unvaccinated are different in other ways. With a clinical trial, we assure that vaccinated and unvaccinated folks are very similar in just about every way. That's the power of a clinical trial. With this is an observational study. People are choosing to be vaccinated. People are choosing not to be vaccinated. Those populations could be very different. depending on the country, and the characteristics can be different based on what country they're from. Like, for example, in the US, people who are vaccinated versus unvaccinated, it's a lot of potential, what we call confounding factors, other differences, political allegiance, education level, rural versus urban, race. Those are all potential confounding factors. In Israel, there's probably different factors, but those factors could explain the difference. And this is especially true for testing. So who are we testing? Are we testing vaccinated people at all? And a lot of countries aren't testing vaccinated people at all because they're vaccinated, unless they show severe symptoms. Whereas with unvaccinated, they may be tested more frequently. So there's a lot of potential source, other explanations for this explanation. And a lot of epidemiologists are leaning towards that. But again, given the lack of, I mean, the Israeli government has not shared the raw data. We don't know. This has not been peer reviewed, as far as I know. So and plus, the Israeli numbers aren't very high. I mean, yes, they're seeing a surge, but it's not nearly as big as, say, the UK. So this might be based on very small numbers. So I don't have a huge amount of confidence in this. If this was the only study, I'd be concerned. However, there are several other much more robust reports, peer-reviewed studies based on huge numbers coming out of countries with very, very robust healthcare systems and data systems that say that the vaccines are much more effective than this. Okay. Now, in the US, I wish we had better numbers for breakthrough infections. We don't. Why? Because the CDC has stopped recording breakthrough infections unless they result in hospitalizations. And that's not because CDC is incompetent, but because CDC just does not have the resources to look into every case. Some state governments, some state health departments are trying to do this, fill in the gap. Utah's doing that, but CDC just doesn't have the resources. So it's not because CDC is incompetent, it just doesn't have the resources to do it. Right now, according to CDC, 5,492 cases. Excuse me, 5,492 cases breakthrough. This is the most recent number since the beginning of our vaccination campaign. So these are the people who were vaccinated but still got COVID. And you can see the breakdown. 49% were women, 75% were over the age 65, 20% were asymptomatic infections. That's probably a gross underestimate because we stopped recording that after a while. Hospitalizations, 5,200 and about 1,000 deaths. Okay. But we don't have good data in the US because we're not really keeping track of it. So we're going to have to rely on other countries. Luckily, I have data from 2 countries with really robust public health systems that are recording this. One is the UK. Now, I have a lot more confidence in the UK data than the Israel data, mainly because I can see this data and the numbers are good. And I know the UK system is really, really good at following this and doing surveillance. So I talked about REACT several weeks ago, and I'll talk about it again. And this to me is one of the most solid pieces of evidence that vaccination is highly protective against Delta. You can see, and I'll get down to the nitty gritty here because I've actually reviewed this several times. This is the nitty gritty here. Here it is. Under 65. So this is the percentage positive. So this is, by the way, each round they take about 10,000 people randomly selected throughout the UK and ask them to submit a DNA sample for COVID testing. So they're looking for infection as well as hospitalization. That's why I really, really like this. Decent response rates. So you can see unvaccinated, they had 0.23% testing positive. Now, again, this is round 12, is mostly Delta. Vaccine, 2 doses, 0.07%. Okay. I'm counting less than 65 because over 65, there's actually 0% positive than the unvaccinated, because there was only 855 people that were unvaccinated in that population, because most of the senior population in the UK are vaccinated. So I'm not really looking at that because they have low numbers, but this is really telling. That relates to about an 88% efficacy. It's reduced, but it's still highly effective against Delta. So that's coming out of the UK. And they've actually followed this up. They've estimated, yeah, with Pfizer, 2 weeks after second dose, against hospitalization, about 93% effective against the B117 variant. That's the alpha. Against the B1617. Let's see. The 2 doses were done. So about 80, they estimated, sorry, it's not in here. They estimated about 88% effectiveness against infection with Pfizer. Slightly less with AstraZeneca. Okay, but Pfizer is still highly effective. They've since followed this up to look at hospitalizations. And you can see Pfizer, after dose 2, 96% effectiveness against hospitalizations. AstraZeneca, 92%. Even 1 dose is highly effective against hospitalization. Pfizer is still highly, and again, I'm much more confident in this data than in the Israeli data, which I don't even see the data. And this is based on fairly large, robust numbers. This is another study. This is still not, this is in Canada. What they determined is, and this is the results from them, this is adjusted efficacy against Delta. So for Pfizer, 87% effectiveness after 7 days after dose 1, 87%. Okay. Notice that they don't have any data for 2 doses for hospitalization or death, mainly because they have such small numbers. And also remember, Canada prioritized getting everybody 1 dose before they worry about the second dose. So they did, their population with 2 doses is fairly low. So that's probably why they don't report this. But infection, symptomatic infection, 87%. So that's coming out of Canada based on some good, robust numbers. Okay. In a study, again, this is not peer reviewed yet, but it will be soon. So given that data, that's the data I'm relying on to show that the vaccine, particularly Pfizer, is still highly effective against Delta. Might be slightly less effective, but still highly effective against Delta. Okay. I would not put much faith in the Israeli study. I just don't. It contradicts far bigger studies out of Scotland, the UK, and Canada. And as an epidemiologist, you got to look at the preponderance of evidence. So you have one Ministry of Health press release versus 3 studies with actual data. I'm going to go with the studies. And those studies show high effectiveness, very high effectiveness against Delta. Now, all this talk has brought about, and Pfizer didn't help, brought about talk about boosters. Pfizer says we need boosters. The public health data doesn't support it. Why? Well, number one, all that data I showed you, 2 doses is highly effective. So say a booster increases to 89, say 2 doses is 88% effective. 3rd dose increases to 89, 90%. Is that worth it? I don't think so. Not the cost. It's not worth it. If a 3rd dose increases it back up to 98, 99%, all right, hey, maybe, but even then I would be reluctant because number 2, as I mentioned before, we have a huge vaccine shortage in the US. I mean, in the world. There are people in Africa without the vaccine. We should be focusing on that rather than getting 3rd doses. Already around the world, there's criticism for the US for focusing on 12 to 15-year-olds rather than, who are, of course, a very low-risk population, rather than getting seniors in developing countries vaccinated. A third dose would be even worse. Third dose to increase our efficacy from 88, 89% to something higher. See the optics of it. At the very least, the optics are very, very poor. So number 3, in the US, what would really prevent numbers is getting those 50% of folks who aren't vaccinated with just 2 doses. That's going to do far more than a third dose to people who are already vaccinated. Yeah, you might prevent breakthrough infections, but the surge in the US will continue until that, and that third dose isn't going to prevent that. What's going to prevent that is getting unvaccinated folks the vaccines. That's what we should be focusing on, not a third dose. Will we need vaccines at a future point? Possibly. I mean, a booster at a future point? Possibly. Right now, the data doesn't support it. It seems like the Pfizer is highly effective against Delta and has long-lasting immunity. All the immunogenicity studies show that it has possibly longer immunity than we thought. Now, so we just don't. I don't think it justifies the booster. Pfizer's, to me, made kind of a PR mistake, saying that they need boosters. They come off as looking greedy. I don't know. I just, but from a public health standpoint, we just don't, there's no need for that third shot right now. A lot of people would ask me that. It's like, you want to top off? You're already at like 7/8 of a tank. And you want to top off, what's that going to do? Not much. So I don't know if that was a great analogy, but yeah, there it is. Just came up with it. So another question I get is, hey, what about mixing and matching? So from a public health standpoint, mixing and matching sounds like a good idea because it alleviates a lot of logistic issues. Okay, so what if the second dose of Pfizer is not available? Can I get, and only Moderna is available? Can I get that? Well, 2 studies, one out of the UK, one out of Spain, has shown that it's fine. The study out of the UK shows that there's no, the side effects are a little bit worse, more slight, a little bit more fatigue, a little bit more muscle soreness, but nothing bad. But otherwise, it's safe. There's a recent study out of Spain has shown that possibly immune response is enhanced. Now, immunologically, that makes sense. You have two vaccines that act in 2 slightly different pathways. Maybe that increases immunogenicity. And the Spanish study seems to support that slightly, not a huge amount, slight increase in immunogenicity. Of course, there's a lot of ways you could interpret that, because we're understanding that that second dose and first dose, the dynamics of the immune response is very, very different. So does it matter which order it goes? Maybe it's just that second dose, it doesn't matter what it is. It's just that, that priming dose plus the second dose. There's a lot of questions about it, but it just seems to be that, number one, it's safe. And from a logistics standpoint, from a public health logistics standpoint, this is actually a good thing. But if you're looking to get a top off with a different vaccine, I don't think it's going to do much. It might, but again, I don't think it's changing our strategy at all. Slightly unrelated. That's good news. Possibly an antibody that fights off multiple coronaviruses. So antibodies are usually very, very specific to a specific strain of a virus. But if this is the case, interesting. All right. I might cover this more. I just found this just recently. It was published in Nature. I might talk about this a little bit more. But it's still very early too, so we'll see. I need to get over Utah numbers. I'm already past time. Utah, we are seeing a surge. I haven't seen today's numbers, but we're definitely seeing a surge. Oops. Yeah, about a 36% increase. We were averaging about 520 cases per day. Not great. We're down to about 200, 300. So not a huge surge, but still a surge. See Salt Lake, Utah, Davis, Weber County lead the way in raw numbers. But if you look at per capita, Carbon County, Tooele County, Utah County, Weber County, Uinta County, Davis County, Iron County, Salt Lake County. So yeah, just about every. So you have the Wasatch Front is represented here, and yeah, so this isn't just a rural surge. This is overall state surge. But if you look at a per capita, Salt Lake County, for example, it's not terrible compared to, it's a little slightly less than, say, Utah County. And could that have to do with the fact that only 35% of Utah County is fully vaccinated, while Salt Lake is close to 50%? Yeah, probably. Definitely playing a role, I think. In terms of changes, Beaver, Summit, Utah County has seen an increase. But again, Summit County, 67% fully vaccinated, but they're still seeing a little bit of an increase. So just warning you, you will see increases even in places that have high levels of vaccination, just smaller increases. So, Summit County, you went 5 to 11. Okay. I mean, you went up to 11, whereas Utah County is 20. So keep that in mind. In terms of deaths, and I never really talk about deaths with Utah because it's never been an issue here. It's actually, we've had some of the lowest case fatalities, but that's kind of changing too. You had Carbon County, Tooele County. So this is per 100,000. Carbon County is really high. That's a bit of a concern. Tooele County, Washington County. Washington County makes sense. It's an older population. It's a retirement community. Then Utah County. Now this is concerning because Utah County is one of the youngest counties in the country, and it's higher than Salt Lake County. So concern there. So we're definitely in the midst of an increase. Most of it is Delta, and I'll show you that in a second. Test positivity is through the roof. We're now approaching 10% and again, that's not because of increased testing, because we haven't increased testing. We're at a very low level testing. It's because we're seeing a real surge. Hospitalizations have increased as well, not significantly. And I don't expect that. I don't expect hospitalizations to ever reach this level unless something changes, given that our senior population, most at risk, most likely to be hospitalized, are more likely to be vaccinated. This is concerning, though. It's all Delta now. So this orange is Delta, B.1.7.2. It is almost all Delta now. Alpha has been completely just outcompeted away. That's how significant the transmission advantage of Delta is. It reproduces twice as fast as Alpha. So it's going to become the dominant strain, and it has. It is the dominant variant. And you can see, and what's interesting is how quickly it happened. So this is within the span of about a month. You can see just Delta showed up, and it's just now dominating. So just about all the cases right now are Delta in Utah, and that is what's driving it. Again, 2 times more transmissible than the original variant. That's what's driving it. So yeah. So even in areas with high levels of vaccination, there's still enough people unvaccinated where Delta is going to thrive, excuse me. Utah vaccinations. I mean, if you look at this, people over 12, 62.4%. It's not terrible, I guess. Our total population, though, less than 50% fully vaccinated, only 50% with at least 1 dose. We're still susceptible to surges, as we've seen. And vaccinations, again, like the rest of the country, we're maybe vaccinating 5,000 people a day. It's really not enough. We're bottoming out. In terms of vaccination, Summit leads the way, then Grand County, then Salt Lake, Davis. So that's good news. You got some of the Salt Lake and Davis, some of the bigger Wasatch Front counties with very high levels. Summit County, which is a relatively bigger county. But you look down here, Juab County is only at 25%. Sanpete County, Uinta County, you got some counties that have extremely low levels of vaccination. Washington County is a bit of a concern. That's it is a more at-risk population because it has a lot of retirees. And then Utah County, 35%. Wow. So, and here is by small area, you can see the concentrations of high vaccination rates is Summit County as well as the Wasatch Front, particularly the east side. And then Grant County. Grant County is a little bit of an anomaly, mainly because of Moab, I think. And who's dominating the unvaccinated folks? Younger folks. It's the younger folks. We're just really just tearing our hair out trying to convince young folks, invincible young folks, to get vaccinated. And it's really low right now. As far as breakthrough infections, so Utah does a really nice job of looking at breakthrough infections. So here is this orange is rate among unvaccinated, and then the green is rate among vaccinated. By the way, I did those calculations. That's about an 82% effectiveness for the vaccinations in Utah, which is in line with what the UK and Canada is reporting, the 80s, high 80s. So it's a little bit lower, but that could be due to a lot of reasons. So you can see, though, the risk of infection, if you're vaccinated, is not zero, but it is much lower. But again, if you're vaccinated and you're still going into an area where there's a lot of transmission going on, the risks of you becoming a breakthrough infection increases. Okay, it is not a black-white, you're immune or not immune situation. It's a lot of other factors there at play. So I guess what I'm saying is that if you feel like you want to wear a mask indoors, even if you're vaccinated, especially in what you suspect to be high transmission situations, I don't think that's a bad thing. And that's going to really bring up some interesting questions about, okay, how do we go back to school in the fall? Yeah. Okay. Last few minutes. I want to go over one thing. I want to go over, I think at the end of the talk, I used to go over like Epi 101, but I also want to go over, let's debunk some stuff. So Marjorie Taylor Greene, who is not a trained epidemiologist, or I don't know what she's trained in, but it's not epidemiology. 5,946 reported deaths after taking the COVID-19 vaccine. Vaccine is not FDA approved. Yeah, actually it is. Emergency use is approval. It's a different level of approval. But anyways, whatever. 33,631,656 Americans survived COVID. The Biden and the Dems are coming to the front door to force that. By the way, if those of you who are regulars, I've talked about this. We need to get more creative. Go door to door, maybe. Apparently, there are folks. Madison Crawford, that kid in North Carolina who somehow got elected to Congress, it's also mentioned that we're going to take away your guns and Bibles while we try to talk you into vaccines. That's not part of our Public Health 101 curriculum, by the way. We don't train our students to, hey, if you go vaccinate door to door, also make sure you take away their Bibles and guns. It's never been part of my curriculum. Can't speak for other public health curriculums. But somehow this is something that is really worrying folks. But this is interesting. Where did this number come from? Also, Ron Johnson, he's talked about this as well. Now, he's a senator from Wisconsin. Apparently, he's good at something in his life because he's made a lot of money and got elected to the Senate. But it's not based on his epi at all. He's also mentioned this. He mentioned a couple of things. Number one, that natural immunity is better than vaccine-induced immunity. I think the immune system would argue against that, but whatever. And also we've had over 5,200 deaths on the VAERS system caused by COVID. Now, so I was wondering, okay, well, number one, let's address this issue of natural immunity. I'm not going to post all the studies that show that vaccine-induced immunity might be superior, but this is a nice little post here. While it's possible some people may have higher antibody response after natural infection than they would after vaccination, we're still learning about this new virus. We don't know how protective natural immunity really is, especially when there's such a continuum of different types of infections. We don't have clear data on how antibody response from a mild infection compared to a severe infection, or how protected those antibody responses are. So this is a blog post from an immunologist and infectious disease expert. Or on the other hand, we do know that the vaccine is very protective. In most people, getting vaccinated generates a lot of antibodies. So far, the vaccine appeared to be incredibly effective, especially when it comes to preventing severe hospitals. This is what I've been saying. Natural infection is really variable. You might have super immune response, or you might have none at all. It's all over the place. What we do know is vaccination is much more consistent in immune response. It is very strong. And I can show you data after data after data, study after study that show this. So even if you are infected, you should get vaccinated, especially if you got infected way back when with the original strain. With Delta floating around, you should still get vaccinated, because natural immunity, especially with coronaviruses, is highly variable. So make sure there's no harm in it. So that's one. That's why 4 Pinocchios. I think it should be 5, but whatever. Let's talk about VAERS though. So I was curious about VAERS, and I went on to VAERS. VAERS is the Vaccine Adverse Effect Reporting System through the CDC. It's public domain information. And I went on it and says, oh my gosh, Marjorie Taylor Greene is right. Oh my God, did I just say that? I guess I did. Oh well. 5,913 deaths. So this is deaths from coronavirus vaccines broken down by Janssen, Moderna, Pfizer, an unknown manufacturer. Oh my gosh, 5,900 fellow Americans died after they got the COVID vaccine. So a lot of people, VAERS has been weaponized. VAERS is an important public health surveillance tool. It's been around forever. As long as we've had, when we started to administer vaccines, we realized there are sometimes adverse effects, and this is a great way to monitor it, especially long-term adverse effects. So this is a great tool, okay? And any doctor can actually report this onto VAERS. And ease of use is important because we want people to, especially doctors, to report this so we can actually monitor this to look at how safe vaccines are. The problem with VAERS, though, is that anybody can report it in. And most of these are unvetted, meaning anybody can report it. And until the CDC actually reviews each individual adverse effect, we don't know if the vaccine actually caused the death or the adverse effect. So, and that is a really tedious process to do. Now, some of these might be someone died of unknown causes a month after they got the vaccine. Correlation, causation issues, serious correlation, causation issues. But yeah, so that's the problem with VAERS. It is unvetted. Anybody can report it. It sits there, and until the CDC can actually get experts to determine if the vaccine caused the death, then it's just correlation, causation. That's it. Here's what we know so far. We know this, I believe there's only been 3 deaths directly linked to the vaccines. And those are the blood clots due to the J&J. That's it. Out of these 5,900, only 3 have been confirmed positively to be associated with COVID, with the COVID vaccine. Okay. But even without that, so even say, and this is the interesting part, say every one of them was linked to the vaccine. Almost close, 13 cases were linked to the vaccine. We've had 185 million plus who got vaccinated. So 52, this 5,900 cases of disease, it's about 0.003%. If we look at deaths from COVID, it's out of the total population of the US, it's about 0.17%. Well, so even if these were linked to COVID vaccine, it's still a lot less dangerous than COVID. And by the way, for case fatality among, deaths among those who are infected, it's 1.8%. That might be a more apples and apples comparison. So 0.003% versus 1.8%. Well, so that's the kind of interesting thing. So even if this were caused by COVID, which they're not, only 3 is confirmed, it's still far less dangerous than actual COVID. So I don't know. It's an interesting argument, but it breaks down very quickly when you start scrutinizing it. I don't know what to do with VAERS, because VAERS has been weaponized by the anti-vax community forever, and people just don't realize that, anybody can report it. It just sits there. It's an important tool, and we want to make it as easy to use as possible. But maybe we need to put some safeguards in it. I don't know. There's this balance between making it easy to use and then other people going in and maybe submitting really, really bad data just to manipulate it. That might happen. I don't know. It's hard to say. But yeah, people need to understand that it's an important tool. It's valid, but these numbers are not vetted at all. And you can see it in the disclaimer. Okay. Reports may include incomplete, inaccurate, coincidental, or unverified information. Number of reports alone cannot be interpreted or used to reach a conclusion about the existence, severity, frequency, or rates of problems associated with vaccines. Yeah, so, but yet it is weaponized by the anti-vax community. So anyways, so that is my little, let's dispel some BS point for today. A little bit about VAERS and how it is weaponized and how you got to be really careful with anybody who says, well, VAERS reported this or that. So, all right. Well, I've gone almost 2 hours, but I missed last week, so I figured that's okay. I will be back next week to discuss more news. Talk more about the boosters again, because that seems to be a big topic right now. And I want to I just want to maybe talk a little bit more about how that, that is a problem. I'll talk more about the global numbers, national numbers, and local numbers. And yeah, otherwise, if you have any questions, comments, concern, feel free to reach out to me. I have no issues, answering questions or anything like that. So feel free to reach out to me. But otherwise, I will see you next Friday. Have a good weekend.